Hi, welcome to The Reluctant Patient. My name is Michael Morris and I'm a prostate cancer survivor. I began making this video series because I wanted to share some things that I learned along the way. From diagnosis through early treatment, I found I was overwhelmed with information, stuff I needed to know and needed to fully learn in order to make consequential decisions about my health and about my future. And I have some insights I'd like to share with you. I want to make it very clear that this video series should in no way be construed as medical advice. It is not. If you are seeking medical advice, particularly in making treatment choices, you should be speaking with your doctor. And if you're not getting satisfactory information from your doctor, then please speak with other doctors and other medical professionals so that you have the complete information you need to have in order to make decisions affecting your life. This episode is an extension of episode 4, Getting the Band Back Together, and I had promised to break it down further, which is what I'm doing now. If you haven't seen episode 4, I'd encourage you to watch it first because it will give context, it'll make this more meaningful, and you'll understand how it fits in. Roughly speaking, episode 4 was about beginning the process of sexual recovery. When you finally get to the point when you're through treatment and you're ready to kind of pick up the pieces and figure out where you are sexually, this is how you get started. And it's mainly a process of assessment and starting some early patterns going in the sexual recovery process. And so we will cover this in 4 different sections. One is a penile assessment, just checking out your penis and finding out what it will do, how it feels, just kind of checking in with it. Number 2, the second topic will be erogenous zones. So everything not having to do with your penis and your testicles and your sex, that down there part, but the other parts of your body that get involved physically with sexual arousal and orgasm. Thirdly is fantasy. What's going on in your brain, what's happening with the libido, and how that's changing, and how you can work with that and get that to work in conjunction with your body so that you can build towards having a good sexual experience. And finally, the last one is nostalgia. And I think that's a really, really important thing to work on, is to go back to those early sexual experiences, because I think they really help you in awakening and rediscovering yourself as you move forward post-treatment. So this little header will fit on the top of each of these 4 sub-episodes, and we'll get into them further. Oh, and one last thing. I promised you I would beat the dead horse. So let's talk about this metaphor, getting the band back together, because I really do think it helps create a framework for all the things that you put together in order to get to a happy place with yourself sexually. And this metaphor is being a teenager and your parents let you borrow the garage and invite your friends over, and you form a neighborhood band, and your band is actually pretty good. And you had a good time, and years go by, your lives go on, and you decide to have a little reunion. You're gonna get that band back together, and you're gonna have a jam session, and eventually you're gonna have a concert. So we're gonna use this as a way of talking about how you get things working again, and how there are so many moving parts, there's so many musical instruments that make up your sexuality, and you need to call on all of them right now. You need to have them all tune up. You need to have auditions from all of them. You need to have them practice a little bit more so they get better at what they're doing. You want these instruments to harmonize and create a really good tune. So that may be a ridiculous metaphor, but at least helps you understand what you're doing at times. Sometimes you're not trying to go for the gold and go for an orgasm. Sometimes you're just doing a tune-up here and there. Sometimes you're just trying out an instrument over here and there and seeing how it harmonizes with another instrument. That's what you're going to be doing with your body and with your mind in order to rebuild your sense of sexuality into something that's durable and enjoyable for you. So episode 4A is penile assessment. And before I begin directly into penile assessment, I want to talk about something that is going to start affecting you right away, and that is failure. you're going to fail. You're going to fail a lot at first, and you're going to have to toughen up and take it. If we're going to play into male stereotypes and what we think of as being admirable male traits, one of them is our toughness, our resiliency, to just tough it out. We finally come out of battle covered in mud and blood, but by God, we got there. And you're going to have to take that kind of mental toughness into the process of rediscovering your sexuality and trying to get things going again, because you're going to fail a lot at first. To give you another analogy, because you know how I just love to throw analogies around, I hope you remember the childhood game of Battleship, where you called out coordinates and someone else had a grid that was hidden from you, and they would tell you whether it was a hit or a miss. And so you'd call out G5 and they would say miss, and you'd call out A7 and they would say miss, and you missed a lot until you finally hit the edge of a battleship. This is the same process. You're going to be trying a lot of different coordinates, and a lot of different coordinates are going to come back saying, nah, nothing there, it's a miss. That's okay. That's okay. It's going to happen to anyone and everyone, and there's nothing to be ashamed of. You're going to keep trying, though, and you're going to realize that you're going to do this day after day, and you're going to try it again and again, and eventually you're going to have a hit or a few hits, and you're going to start finding those battleships out there, and you're finally going to really start nailing them down and sinking those battleships. In other words, really getting a sense of shape and location. And that's what you're doing with yourself sexually, saying, does this work? And does this work? Does this work? And you're going to get a lot of no's at first. And as you repeat them, some feeling is going to start coming online. So just keep that in mind. It's just really important not to be discouraged. And also, something else that's going to happen is, or may happen with you, it just depends, is sorrow. A lot of times when you're attempting to do something, especially directly with your penis, you're remembering how you used to be able to do that, and now it doesn't happen anymore. And that's so sad. It really hurts. It really hurts to see that fail, that part of you fail. And so there's a part of it that you're taking in as you're attempting to work out something new, where you're facing that loss in a very, very specific way. And that's not the same thing as discouragement. And unfortunately, with sorrow, it's just something you just have to live through. It's something you really have to experience and feel sad about it and express that sadness however you feel you need to, or not. But feel it all the same, and that's part of the process. And you can feel sad while still moving ahead and trying new things. You can do both of those things. So keep that in mind. If you're seeking sexual therapy following treatment, that means you most likely had a radical prostatectomy or radiation treatment. In either case, some degree of damage will be caused to your cavernous nerves. It's a system of nerves that run through the center of your penis that are primarily responsible for erections and for sensation in your penis, and they also play a role in urinary control. So let's break this down a little bit further. If you had a non-nerve sparing radical prostatectomy, that means your cavernosa nerves are kaput. You'll never be able to access them again, which means you're going to have to find other ways to have sensation in your penis, and you're going to have to find other methods for having an erection if that's important to you. As for partial sparing and nerve sparing RPAs, the good news is that you can claw back some of that sensation and some of that capacity for erections, particularly if you put some effort into it. And so we will talk about that. And then with radiation treatment, I'm not quite as well versed on this, but my understanding is that damage can happen to the cavernous nerves over a period of time, even up to 3 to 5 years. You can still discover that there's some degree of damage. So we're going to address the cavernosa nerves a little bit and how you might want to continue to stay in the game there. But primarily, we're going to talk about most of us who come out of treatment in some degree of shock, where we're looking and saying, uh-oh, this doesn't work at all, and I don't feel much of anything. And by the way, a little factoid for you. I read one survey, or not a survey, but analysis that said that about 90% of men report significant reduction in sensation in their penis following radical prostatectomy, regardless of whether they had nerve sparing or non-nerve sparing. So there's a lot of shock to that region, and that's a big deal. It's something that we need to work on. So we're going to focus on some of the other nerves that are in the penis, some of the nerves that are closer to the surface as we go through this. So getting the band back together, you're going to tune up your penis. Let's talk about this. This is probably the most important player in the whole thing. So we want to really examine this thoughtfully and systematically as we go through this. I would recommend that you really pay attention when you start working with this process. For some people, it might actually be good to take notes. I keep a little book, I call it my little field notes book, that I take everywhere. You know, I put my shopping list, my to-dos for the day, but I also have used it to write down some of the stuff I've kind of learned about myself sexually. God forbid I ever leave this out in public and someone reads it. But it's important to sort of take account of everything that's going on, and you're gonna like when you're doing a jam session or tuning up or getting a few players together, you're gonna try everything out, and this is the objective here. This is just a sound check. You're gonna go through everything. What you're going to do is you're going to find some time, some real private time when you're alone and safely alone. No one can come bursting into the room. And you're going to examine your penis, and you're just going to check it out. And you're going to figure out where you have sensation and where you have interesting sexual sensations, something that lights up in your brain and says, okay, that feels good. You're going to try to figure that out. And since we're dealing with surface nerves, instead of that central cavernous nerve, instead you need to really start off with a really light touch. So as you examine your penis, instead of giving it a big old yank, you're going to do something very different from that. You're going to want to tap, gently rub, wiggle, tickle, whatever you want to try, different types of motions, to just very lightly make contact with your penis. You'll find, strangely enough, that you'll often get more of a charge, more of an electrical note back to your brain when you touch lightly than if you touch heavily. And so you want to work with it this way. First place to look, which is what all sex therapy books will tell you immediately, is go for the frenulum. The frenulum is that fleshy, almost crepey bit of skin that's on the underneath side of the head of your penis. I like to call it the turkey twaddle. That's what it makes me think of. But that's a very sensitive area. There's a lot of little nerve endings there. And so that's a good place to start. And there's a good chance you might have some success in that area. And so what you may want to do is you may want to take your finger and just strum it or tickle it just a little bit, or gently rub it in circles. You may want to put a little bit of gel on your finger, and so your finger is moist and lubricated as you rub. You may want to try a few different things. You want to try the shaft of your penis, and another area that has a lot of potential is the underside of the shaft of your penis. And again, you know, you're going to have more success with light touching. And so using your fingers, playing your penis like it's a flute as opposed to pulling on it, but fluting it, tapping it, doing gentle motions, doing gentle wiggles, pulling the skin of your penis back a little bit, just gently, not quite doing a full-on jerk, but just a little bit of pulling back. It can go a long way in giving you sensation. What are you trying to do? You're just trying to see what lights up. You want to make those observations. You want to make note of it, whether it's, keeping a journal like mine or in your head or on an Excel spreadsheet. You want to literally make note of everything that works for you. Anytime something goes up and says, hey, I feel that, you want to take that in and make that observation. So the underside of the penis, I find the base of the penis is also a source. And to me, that makes sense because if you're putting a little bit of pressure down there and doing a little bit of rubbing down there, you are also encouraging blood flow into that area, and that's very, very, very helpful in that process. So at the base of your penis, and actually the base underneath your testicles and penis as well, can be a hotbed of sexual sensation. So you want to tap all the way around. You want to try every inch of it and see what you can figure out and what you can make of it. And you're going to do it again, and you're going to do it again, and you're going to do it again. This is doing a couple of things. One, you're just sort of mapping out, hey, what's working and how does it connect to my brain? But in the process of trying these things out, you're once again creating this back and forth. You're starting to create a feedback loop with your penis and with your sex organs in general and with your brain, and establishing that, hey, we need to have a conversation here. Here's the back and forth. And when you feel this from me, that equals arousal. And so you should start thinking even more arousing thoughts, and then send a message back, and I'll apply more pressure, or I'll apply more intensity. Now, one of the things that's going to happen, which is just so frustrating, and it's really, really important to recognize this, is you'll start feeling something good. Maybe it's that frenulum, and it starts feeling really good, and it's feeling really, really good. And you're thinking, okay, I got a handle on this. And then all of a sudden it just stops. It's feeling good 1 minute, and then you feel nothing. You feel absolutely nothing. And it's like, what happened? Well, I have a theory about that. I think I know what happens with it. And that is, when you had a fully functional penis, which means your cavernous nerve system was fully working, you were relying on that for your sexual feedback as well as getting an erection. And in order to do that, you have to access those nerves that run really deeply in your penis. And so you have to be a little bit rougher. That's why you squeeze hard. That's why you yank hard, is because you got to get the message through several layers of skin down to those nerves to send that message along. Now that you're not using those nerves, and instead you're using surface nerves, they're lighter in touch, and they respond to the immediacy of touching right there. What is happening to you is you're getting aroused, and instinctively you're saying to yourself, okay, let's escalate this by gripping harder, by pulling harder. And that's what you do to access your cavernous nerves. But that's not what you're doing here. And so it's kind of counterintuitive. What you would think, it's like, okay, we're getting to the next step, okay, intensify this by gripping harder, by bearing down. That doesn't work. It actually sort of cancels it out, because those surface nerves are sensitive. And when you squeeze that hard, and when you push that hard, and you pull that hard, you're going to get less response from them. They're going to get overwhelmed, and they're going to shut down. And so this is what I've learned to do, and I hope this helps. But I really found this to really, really work. At first, I get so discouraged. It's like, okay, I'm feeling good, and then nothing. And it's like, screw this. It's just like, this sucks. It's just like not getting anywhere. But what I finally learned to do is, instead of giving up, as soon as I started losing that sort of sexual interest, I would just throttle back a bit. I didn't stop. But I just sort of said, whoa, let's just slow this down. Let's get back to light tapping. I've just noticed that I start tapping a lot harder, or gripping a little bit. And I'm going to back off a little bit and go back to that lighter sensation that was making me feel good. And while I'm doing that, I'm just going to take a breath. I'm going to relax. I'm going to realize that I've still got it, that I'm still heading in the right direction. And then I'm going to feel around me. There's just this, for me, there's this sort of mental picture of when I get to that point, I've really narrowed and focused. I'm sort of heading towards orgasm. And what I need to do is relax and be less focused and feel that sexual good feeling all around my body. And it really does. You can feel it everywhere in your body, even when you're just tapping your penis and it's giving a good sensation. You can feel it well through your whole body. And so let that build up again. Let you recapture your mojo by just backing off a little bit and feeling it once again. And then just take your time with it and then run up that hill again. Your instinct for a while is going to be to bear down, to grip, to pull harder, to do all those things. And you're going to have to teach yourself not to do that, but instead stick to your guns, keep it light, and let your brain and these nerves on the surface of your penis talk to each other. Okay, then a couple parting shots on this topic. A couple of other things that might help you. One is when I struggled with things, I found that if I practiced this penile exploration standing up, I had better results. And I can only surmise that's because you're letting gravity help you here, that you're having greater blood flow in your penis. I mentioned this in earlier episodes that really maintaining blood flow to your penis is really important to the general health of your penis. But I think it also improves sensation. So if you're not having a lot of success and you're laying on a bed, stand up. Again, lock the door to your bedroom and just stand up buck naked and examine yourself that way, and you may have better results. Another thing that really bothered me, and this gets really personal, but I'll share it with you, is that, again, talking about sadness, is here you are working with your penis, and I would use a lubricant along the way, and so I just have this sad, limp, dead thing in my hands, not responding to me at all. And it's just really hard and sad to think of that. But I think one of the sort of feedbacks that I get that makes things really sexy is the texture. And that is your penis gets harder. And as it becomes more rigid, it has a different texture to it. And that doesn't happen when you are unable to have an erection. And so I had a lot of success with rubbing myself through a pair of jeans or through a pair of heavy canvas pants. That roughness of the fabric gave me the sensation, the feedback to my brain that my penis was hard, or at least it had the texture of being a hard penis. And I could feel things. And they felt a little bit deeper in me too, because they were protected by a layer of clothing. I could feel things, and it kind of simulated the way things felt in the past. And so it helped my brain make that connection back and forth. So one last time, be tough. Be tough in the face of failure. It's going to happen, and that's okay. That's part of the learning process, and you'll get there. I promise you'll get there. You just have to be tough-minded and persevere. And also, take care of yourself.